Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is going to bring curiosity, humor, and reflection to the world of palliative care. We're going to explore the joys and challenges of working in this incredible field, including topics related to education, advocacy, self-care, service provision, and leadership from around the world. Whether you're a nurse, counselor, pharmacist, doctor, or any other type of healthcare worker, or you're just someone who's interested in learning more about children's palliative care, then this is the podcast for you. I'm one of your hosts, Rachel Neufeld from Vancouver, Canada, and today I'm joined by Mark Stoltenberg. Mark is the medical director for a home-based palliative care program at Mass General Brigham in Boston, USA, as well as co-director for the Global Palliative Care Program at Mass General Hospital, and he's the assistant professor at the Harvard School of Medicine. Let's get going. Thanks for being here, Mark.
Yeah, thank you for the invite, Rachel. I'm really happy to be here and spend this time with you and your audience.
I would love to hear your story. So if you could tell me a little bit about how you got to where you are now.
Sure. I'll try to keep it brief. So I have been in palliative care since 2015. Before that, I was in primary care as a family medicine doc, and also had worked in global health for a long time. And I would say my core interest, having had that initial training, was trying to apply palliative care principles and initially learn more about palliative care principles and how they could be helpful outside the US and mainly in low and middle income countries. And I had the wonderful opportunity to work under the mentorship of Dr. Eric Krakauer, who's a real international leader in global palliative care. And so initially some experiences in Rwanda and Kenya, and then since have pivoted to most of my work being in the Caribbean and Latin America. So now over the past decade, working with partners from individual clinicians all the way up to ministries of health and national and international leaders to how we can partner and work together to increase access to basic palliative care services to every corner of the world.
That's amazing. Sounds like you've had quite a wild experience international, being in Africa and now Central America. What drew you to the Caribbean and Central America?
Yeah, it's a great question. So I think in general, I was always open initially early in my career of where there was help and where there were opportunities for partnership and collaboration. And a number of opportunities came up initially in Jamaica and also in Chile. Another big piece, my wife is from Colombia, so I speak Spanish fluently. We speak Spanish at home with our kids. And then I lived in Bolivia for a year and then also spent an extended time in Peru and other parts. So I think my heart had always been in Latin America for a long time. And I think there's also a piece that I felt when I was in East Africa of, I think our histories and our sort of lives are so deeply connected in this hemisphere of what the US does, both positively and negatively, has a huge impact on our neighbors and vice versa. And so there felt a sense of responsibility and sort of shared history and just that it felt this was the place that I could make the biggest impact.
What a great history. And we are here today because of this new program that you're working with, along with Dr. Megan Doherty, who we know from this podcast. Wondering if you could tell us a little bit about this new project with WHO and ECHO.
Yeah, absolutely. Excited to share with you. So there has been a working group for palliative care for around the last 3 or 4 years at the WHO that's brought together various international leaders trying to partner together to come up with strategies to increase access to palliative care around the world. And then that recently, Megan was hired as the first sort of formal person at the WHO level as a secretariat for palliative care. So I think Megan, listening to everybody that was in that working group and hearing what was occurring, and also her prior experience with ECHO, and I also have had a lot of experience with ECHO in Latin America and the Caribbean. We've launched various ECHO groups. The idea came together to launch an ECHO program that's specifically focused on palliative care implementation. And I can say a little bit more about that as far as what it's aiming to do, but that's sort of the origin story of how the project came to be.
So this is WHO being World Health Organization, clearly then globally focused on increasing access to palliative care, but sounding like starting with, we have to build the programs so that people can access them. So starting really at the base. And what about this program is special in terms of reaching a global audience? I mean, besides the fact that it's under WHO, I guess. And sort of the benefits of a digital platform, I would imagine, be impactful.
I think that's absolutely part of it. I think the way I'm thinking about this project, and I was honored that Megan invited me to co-lead this project together with her, is so there, I think we're in a really unique point in the developmental stage of palliative care around the world. So I think 15, certainly 20 years ago, maybe even 10 years ago, it was still not fully on the international radar. I think ministries of health weren't always clear of what it was. Is this just end of life care? And so it took a lot of real heroes and sort of leaders of the field to write the international guidance documents, to get the WHO and the World Health Assembly to declare that access to basic palliative care is a human right and an ethical mandate of healthcare systems, which that mandate was put out in 2014. So that's wonderful. And we have these sort of international guidance and some statements and declarations, and ministries of health are starting to take notice. And then, in my experience, partnering with folks on the ground, trying to figure out how do we get from A to B, I think there's still a pretty large gap between those local partners and those either regional or national leaders and that international guidance. And so I think a core way to think about what this project, this specific ECHO program is aiming to do is to build bridges between those two things. So to take the international experts that wrote those documents, connect them with leaders that either have successfully implemented some of these things and say, where do we need to build the bridges? What are the actual concrete guidance that a Ministry of Health or that a leader of a national palliative care organization or a regional leader in a large city or in a small town, what do they need to be able to implement this guidance so that we go from not just ministries of health saying, yes, we should do this, but actually scaling and implementing it so we can start to close the gap and making sure patients have access to this.
That's not going to be an easy job. I can only imagine. Some of the work that we do in South Asia too, like there's all kinds of really good intentions. And the ideal that this international and WHO have established, the ideal access to palliative care is great. And then you and I both have worked in places where we know on the ground, actually doing the work is really difficult because they don't have access to the resources. They don't have access to the acknowledgement of their specialty. They don't have the spaces or the acknowledgement that they can build these programs. So there's all these people on the ground that want to do this work. There's international high level people saying this is really important and it's a human right. And it sounds like this project is trying to find that meet in the middle of how do we actually make those two connect. I love that.
Yeah, and I think a way that I would think about it is I have found over time there are really invaluable resources from both of those parties, and we just need to connect them. So there's experience and there's years of advising ministries of health that some of the folks at the international level have that is absolutely invaluable and is needed on the ground. And I think the piece that I have deeply learned, and it's part of why I love this work so much, there is a creativity and innovative spirit to build something, sometimes with little to no resources, initially on just energy and spirit alone, but ending up solving problems and thinking about responding to suffering and how much you can do with very little. That just has completely changed how I think about palliative care. My main framework for how I communicate with patients was born in Brazil and then adapted in Chile. It's not what
Right.
I learned in the US. So I think there's also this invaluable resource of our partners on the ground that if we can get folks in communication, so sometimes the international folks talking to the folks that are on the ground, but many times it's actually this group on the ground talking to this other group on the ground. So there's this wonderful innovation in Brazil. Let's try to use that in Paraguay, or let's try to use that in Bolivia. And there's this other great thing they did with the Ministry of Health in Costa Rica. Why can't we replicate that in Jamaica or in Trinidad? So that for me has been the really fun part is it's not just bringing international guidance down, but it's actually learning from the innovation and these incredible partners that we get to work with and giving them a space to share their incredible wisdom and help replicate what did work well and then adapt it to the cultural context and the unique of each individual country. It's fun
Yeah,
work.
absolutely. Because they're the ones that know what life is like on the ground. There's the ones seeing the patients and the families and what kind of care they need and cultural implications. And
Yeah.
they're the ones who really know what they need. So I love that. And that's one of the visions and the missions of Two Worlds and the Sunflower Network, as well, is that we're finding leaders locally to help empower them to build. But I think that you're absolutely right that what we see too is this gap in that middle ground of like being recognized by the government leaders or, who needs to help fund things or who recognizes these professionals as the professionals that they are. So
Yep.
you've got all these, I love that creative MacGyvering of doing the work with next to nothing And I think that some of us from resource rich places can help engage that middle from the top, like you guys that are working under WHO. And then when we work with those local people on the ground, then we can become a voice that helps them meet those people in the middle to really see this program through. So that's actually really exciting. And who is your overarching audience then? So I'm hearing a little bit about Ministry of Health level, but also there might be other government level, there might be local level. And who are you hoping to reach as the audience of taking this education?
It's a great question. So we're thinking about it sort of in two steps. So this year is sort of a mock or pilot period. So we are building out the content. So we decided the 8 core topics that we thought were important based on a public health model for implementing palliative care and also leading on some implementation science from the cancer world. So we picked 8 core topics. And then what we're doing is we're bringing in one international expert in that topic and then one country team that has done an excellent job in that area. And we get them to talk ahead of time. And then we then have a discussion. So it's less of a presentation and more of a discussion together with the WHO working group for these 8 topics to really refine what is that knowledge in the middle. What does it look like when you take the guidance and actually apply it in a context and it goes well? What's needed? What sorts of resources can we lean on? And so this whole year, we started in March, and it'll go through December, is building that content. And then the plan is starting in 2026, if it ultimately gets authorized to continue, is then we will open the program up to country teams that could apply to take it. So ideally, it will depend on various variables. We're probably somewhere between like 8 and 15 country teams that would each have a number of people on their teams. And then they would not be coming in as a work in progress. So they would start the program with an initial needs assessment of where are we at right now? What is our current data points? Where do we need to focus on? And then they would be walked through over the next sessions through each topic. What are the core competencies in this area? What would it take to implement them? And to quickly give examples. So the first one is thinking about their palliative care indicators at a national level. The second one is thinking about policy and laws. And then there's others on healthcare and workforce training, another on access to essential medications and equipment they might need, others on partnerships, others on monitoring and quality evaluation. So it's all these sort of core components that would be needed to go from limited access to robust, high quality access within the public sector. So that will ideally be the audience starting in 2026. This year, we're really trying to do a really thoughtful and comprehensive job of building the content, which we're finding there's the guidance document content, but the sort of how it gets applied and how we would think about adapting that and best practices for doing that. It feels like we're building something new. So it's been really, really exciting so far.
Yeah, and also a lot of work, it sounds like. And I love that you're starting with what's needed. And then as you build this out and hopefully go into implementing the actual education, then I suppose the audience or who's actually engaging in these echo sessions will also vary depending on who those leaders are in those countries that are wanting to move ahead with this work. So you're creating information and next steps and all of that, and then finding the people. So the roles might be different depending on who's actually in that team from each country. Okay.
I think that's right. And I think ideally it would be a diverse team. So we would ideally want some representatives from the Ministry of Health so that we know we would have buy-in and support from the governments in the countries that would participate. And then ideally members from, if there's a palliative care professional association, ideally not just physicians, but potentially nurses, chaplains, social workers, to make sure you bring a really multidisciplinary group that's coming from various stakeholders. I think that will significantly increase your chance of success of actually creating and implementing new processes for the country to move things forward.
Do you think that this project and also some of your stakeholders and international high level guidance is going to help you reach people at the Ministry of Health level? Because I would imagine some of these ground level frontline workers might feel intimidated or, like reaching that level feels like a reach for them. Do you think that this program and who you are in terms of the team creating this will help reach some of those higher level governments in a different way than our frontline workers? Or do you think it still needs to come from them reaching out to their ministry saying, I need you here?
I think it's both. I think in our experience, so both at Harvard University and our program at Mass General Hospital, and also I used to work as a consultant for the Pan American Health Organization, which is the WHO regional office for this region. I think when a neutral external party enters, there's obviously complexity and power dynamics that are at play. And if done right and done openly and deeply culturally humble, it can actually lead to people coming together to the table and sort of a breakdown of whatever power dynamics or history might have prevented them from working together in the past. Doesn't always work perfectly, and that's again a part of the lessons learned and how we try to move forward. But there are times when it's done right. Having an external group like the WHO or others can sort of clear the table and open up a new space for collaboration and partnership where it already exists. Of course, great, then you're just building on that. But in places where there's been challenges there, where they haven't been able to get a foothold, sometimes this can be this sort of spark that leads to new ways of partnering and collaborating. What I find often with ministries of health is we'll have a wonderful national leader that's been doing high quality palliative care, professing all of the sort of core truths, and just hasn't really been heard or picked up. And then all of a sudden, some international group comes in and says literally the exact same thing. And the Minister of Health's like, I love that idea. And so we first make sure we align and connect with that national leader and make sure we're saying the same thing. And then if they do, if it takes us to get them to start listening, we say, oh, wonderful. And that's exactly what our colleague here has been saying for years. And we sort of pass that power recognition over to our partners. So again, you have to be very thoughtful and have a very deep, trusting, and open communicating relationship with your national partners for that to work. When done right through a vision of equity and sort of shared mutual respect, I think it can be really successful.
That's so interesting. I can absolutely see how it could go either way. And so with our role, and I say our too in terms of the Sunflower and the Two Worlds work that we do, as well as the work that you guys are doing at a higher international level, but that we are finding those leaders locally and empowering them with our support. So sometimes if our voice is important, that it always circles back to really those local leaders, and that we're really trying to find ways for that local leader to feel empowered to do that work.
Yeah, I think that's exactly right. I think probably one of the core lessons I've learned is, and a way to pause is the current objective mine or the international institution? Is this a research agenda I'm trying to do and I just want 7 countries to do my agenda? Or is it going to a partner and just saying, here's the 7 resources I have access to, you pick, you have the voice, what would be helpful for you? And if my thing that I'm really interested in, they're like, yeah, that's not going to help me here. Am I willing to say, okay, then I have no interest in that? And that's a way to check, is this giving voice and sharing our power with others? Or is it a sort of the challenging term, but a new version of colonialism? We're actually just bringing our versions and our goals to our partners. So I think it's never a thing you just get good at and then you go on autopilot. It's a constant state of reflection and pausing and making sure. But I think it's deeply important to do this work well.
Yeah, I couldn't agree more. And I think that part of the work that I find so beautiful too is that we keep checking in, we keep showing up, but it's not for us to tell you how to do things. We'll guide and we'll educate in the ways that you might want and need, but also keeping that connection, that relationship, so that as needs change, we can adjust to that and maybe support you in a different way. So I've really seen that relationship building also be absolutely vital to helping them feel like they're being heard, and that we really are meeting them in terms of what they feel like they need to start their programs and stuff. I feel like we've kind of touched on a lot of this, but do you see anything else, like maybe examples of your work in terms of how this important work is supporting greater implementation of palliative care globally? Like how will this project move forward in terms of increasing access to palliative care globally?
Yeah, it's a great question. So as I described a little bit at the beginning, sort of, I truly believe we're at a new stage in the development for palliative care. So we needed those guidance documents. We needed that sort of forceful strategy to just get this on the radar of folks. And I think that was important. I think we're now in a stage of collaboration, of scaling, of connection that it's a very different set of skills and I think a very different set of priorities. So as we think about doing that well, I think it's a much more gentle and welcoming big tent of trying to get everybody under the umbrella, whether that's ministries of health, whether that's cancer leaders, whether that's folks in the NCD space of saying this can be something that can be sort of a consensus that we're all working on. And then the right way forward might be slightly different in each environment. There might be private groups that our goal is, of course, to make sure all patients, regardless of ability to pay, to have access. And in some countries, if there's a private group that wants to move it forward, and that's going to bring sort of a perspective of palliative care that's important and valuable, I think there's a way we want to invite everybody to the table so we can participate and grow this. So I think in thinking about that, one of the things we're seeking to do, so we also recently, in collaboration with the working group and some of the research team that's at Atlantis, which is the University of Navarra in Pamplona, Spain, is how we can build networks so that as these things are growing, we can be sharing best practices around the world. So specifically, if we end up having, let's say, 8 or 10 countries that participate in the program in 2026, that would be wonderful. And we hope that they find it effective and successful. And then I think my constant to any of my partners is, yep, happy to help here. And then how are we going to help the next people next to you or coming up behind you? So could those 10 countries then serve as mentors or guidance for the next 10 countries that come in? And over time, could we start collecting the wisdom that's built to make sure that we can share it as widely as possible? Because I think this will come in stages, but we all need to be in agreement. We need to hit the highest quality possible, and no one can rest until we know every corner has access to at least basic palliative care. And we should probably prioritize that before further refining in one particular area until everybody has access. So I think if we are aligned in that mission, then I think that that is sort of the vision or the strategy for as folks participate in this program. Okay, now who are you partnering with and who else are you helping to make sure that we can keep growing in other parts of the world?
Yeah, great. And I feel like that kind of answered what was going to be my final question around next steps. So it feels like that is goals for next steps of seeing who we can get under this umbrella for now and then creating networks. So your program can still become that hub that continues to mentor the countries that have participated, but then empowering those countries to also then expand beyond. So it becomes even more hub and spoke model of
Yeah.
and hopefully start pulling in their neighbors or, hey, I know this person and they heard about our program. So now we're going to pull them in and expand that way.
Yeah, I think that's exactly right. And I think another piece of this, so adding to that, as far as next steps and what we're seeking to do. So it is a very severe understatement to say we're in complicated times politically and nationally and internationally. I think, especially within the palliative care community, there is an immense hunger to stand on our values and say every human being is important, regardless of what side of a border that they were born in. So I think for those that live in a country like mine that's feeling challenged and more complicated, I think there is a hunger for people to be able to live by and stand up for those values. And so I think another piece is historically, I think it's often been perceived that, well, if you're not going to pick up and go live in another country for years at a time, like you won't take the time to learn global health. So therefore, you're really kind of not welcome in the global health community. I think we want to very firmly say anyone who's interested that will bring a sense of cultural humility to the work and know you might have an immense area of clinical expertise for palliative care for 20 years, but there's going to be an expertise that you will encounter in Trinidad or Jamaica or Chile or wherever you go. But you have skills that could be helpful in other places. And I think welcoming more people into the fold and saying, if you have something to offer and you're willing to give free time to help write a grant or to help teach a 1 hour course or to go down and build a friendship with a palliative care nurse or doctor in any part of the world, let's find ways to use that. Because I think we as a community need to react strongly and say we stand for something that goes beyond this sort of competitive zero-sum game. And we want to be deeply connected to those outside of our country and anyone who's suffering. So I think that's another part of next steps is how can we invite more people into this wonderful, beautiful, complicated, diverse mission, which is expanding palliative care.
And you're absolutely right. And I love that you use the word suffering because that's where my brain was going. That human connection is global. Doesn't matter what your language is, your culture, or your country. The mission of palliative care to reduce human suffering, I think, connects us all on that human level where we can maybe let some of those other pieces go off to the back burner while we focus on this. That's such a human piece that is worldwide. Humans are suffering around the world, and our role and our mission in palliative care is to reduce that suffering. What a way to bind us all together, I think, in a really beautiful way.
I completely agree. And I would add to that, there are people suffering in diverse ways around the world. And there are these incredible heroes that are responding to that suffering in the corners of the world where we're trying to partner. And their creativity, their energy, their resiliency has profoundly changed how I practice, how I see my patients. I think the phenotypes of suffering I now have, thanks to my experience with experts in all of these countries that I've shared, has made me so much better at caring for patients in Boston and in wherever I else might be. I think that's another piece to sort of add to the invitation. Not only could your expertise be helpful, but your own practice as a clinician and also just living as a human will be changed if you have the opportunity to just spend some time with these incredible heroes that are leading palliative care in other parts of the world.
I could not agree more. I think my first trip to India with Two Worlds I bookmark that clearly to other people to say it's the people on the ground doing the work that are drawing me in. They're incredible, incredible people around the world trying to make things better for their patients and their families. So tell me then, how would people find this project or get involved or watch out for, hey, I am in this country and I do want to participate in this? Where can we find you? And then we can make sure that this goes in our show notes and, trying to invite experts to maybe help in ways, that they can. And then also people globally that would benefit from this program.
That's wonderful. And I appreciate that offer and invitation because we do really want to welcome folks in. I think for now, the first piece I could offer is certainly so you can go to our website so the Mass General Hospital Global Palliative Care Program. Our emails and ways to get in touch are there. We are also moving forward to create a more formal network in the English-speaking Caribbean, because for many folks, the language barrier is a challenge. So if there's parts of the world that also speak English. So we're in the midst of revamping that a little bit. I also have a conversation coming up in a few days with some leaders within the American Academy of Hospice and Palliative Medicine to think about, can we do a formal partnership where we can invite people as a part of the special interest group in global health to participate. So I would say more to come. But for now, if I can direct folks to our website, feel free to reach out to me. And as we're starting to build these more concrete ways for people to get involved, we can pass those along. But in the short term, I'm always happy to meet with anyone who wants to find a place to get involved. I probably have 1 or 2 of those a month. So anyone that's listening that says, hey, I want to get involved, shoot me an email. We'll schedule a Zoom and we'll figure something out.
Thanks so much. And I will make sure that we get that information into our show notes so people can get to your website and get in touch. And we look forward to, I'm particularly excited to see where this project goes. So I will be keeping my ears to the ground. And thank you again very much for joining us and for spending time exploring this project. And thank you very much for all the amazing work that you are clearly doing as one of those heroes working on this globally. And I wish you all the best.
Thank you so much, Rachel. Thank you to your organization for the invite. Thank you to Megan Doherty, who had suggested or brought up my name to come on. It's a pleasure partnering with all of you in this great work. And I hope this is one of many conversations.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.